morning. We're going to be doing insertion of a nasal gastric tube. So we've already provided privacy, we've done aided, as well as checked the patient's ID and their allergies. So we've talked to the patient regarding education, what they should be anticipating as far as the procedure, and then we're going to go into our hand hygiene. I've already placed a towel around the patient's chest so that we could protect their clothing. So the first part is going to be measuring the tube. This is the packet that the tubing is going to be coming in. I've already taken out the tubing, so we're going to measure. I've brought the patient up to a comfortable level for me to perform the procedure. The patient is in high Fowler or 45-degree angle. You are doing this so that we can prevent any aspiration while placing the tubing. So now we want to prepare by placing clean gloves on. Prior to applying my clean gloves, we needed to measure. So we're going to measure from the tip of the nose to the earlobe, and then from there to the xiphoid. And where you stop here, this is where you're going to put your tape to measure it. You can also use like a marker that won't wipe off, but because of the fact that sometimes they can wipe off, we'll use tape to measure where this goes. Okay, there we go. Okay, so now we've measured. We're going to use our lube. So we use the lube and we're going to lubricate the tip of our NG tube. We want to do this so it can go in easily and to make sure that there's no friction or anything. We want to make sure that the patient's nares are patent and there's no issue with swelling or redness in the mucosa of the nares, so that when we take the NG tube and place it through the nose, it will go through without any issues. We have a cup of water with a straw in it, and this is for the patient to sip while we're placing it. And then we also want to ask the patient to place their chin down towards their chest and swallow as we place the NG tube. So now we're going to insert the tube through the nasal passage, and as we insert, we're going to have them swallow, and we don't want to force it, so you may want to twist a little bit so that you can get it to pass through the tube. And if you feel like you're getting resistance, you have to twist some more, but you don't want to force it. You see how it's going in? You just want to help ease it in. And okay, okay, and we're gradually, it's gonna take a little time. You don't want to cause any injury to the nares, and it's gonna go pass through the nose, down the esophagus, into the stomach. And this is where we're going to stop. So now we need to secure. And prior to doing this, I did already take the tape that had to be used for securing this. Let's see, was it this way? Yeah. Oh God, it's been a minute. So once we've placed it, we're ensured the tube is not coiled in the pharynx. Continue to determine. So we're going to check for placement, and we will use our – syringe here, and we're going to aspirate. 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 And we're going to aspir to make sure that we are in the stomach, and we want to get gastric juices out. And if what we'll do is have our pH paper nearby, and we will place it on the pH paper, and we want to make sure that the pH is less than 4. So once we've done that, we will remove the towel, we'll secure the NG tube, and we will also notify x-rays so that they can come to the floor and do a KGB x-ray to ensure that this is placed where it's supposed to be in the stomach. We will not use the NG tube until we've had verification of placement. Okay, so now we've secured the tube. We're gonna take the towel away, the cup with the straw. We're gonna make sure we keep this syringe at the bedside at all times, and we're gonna discard anything that we use to place, and we're gonna make sure that the tube is secured to the nostril and to the gown. The patient's bed is at the low position with their call light in place, and then we will check on them after the x-ray confirmation of placement, and after that they can start feedings. Okay, so now we're going to remove the nasal gastric tube. I've already done aided, educate the patient on the procedure that we use as far as removal. And I've verified the patient ID, asked about allergies, and I have my gloves on. This is the appropriate PPE. So what I'm going to do is place a towel underneath the patient's chin and nasal gastric tube. I want to ensure when I do that I don't dislodge it before actually doing the procedure. I'm going to put the eminence basin here so that if the patient during the time of removal feels like they need to gag or vomit, then there's something here for that. So what we're going to do is remove the tape that's secured on the nasal, and we're going to detach the tubing from the gown. And so I'm going to install a 30 to 50 ml syringe of air through the tube so that we can make sure that if there's any gastric juices, that those are all removed before taking the tube out. We're going to clamp or kink the tube between the index finger and the thumb, and we're going to ask the client to take a deep breath and hold it. And while I do it, I'm going to smoothly and steadily remove the tube. You may get some gastric content, so we want to keep the eminence basin as far up as possible. And then once it's out, we're going to remove this, the eminence basin, and the towel. You want to measure any output that's in the container and dispose of the tubing and suction equipment per facility policy. Remove and apply clean gloves. And we want to clean the nares and provide oral hygiene. So I would have a basin to the side with some warm water, clean the nares, and then if the patient is NPO still, I would just use an oral swab that's a little damp to clean out the oral hygiene to make sure that there's no gastric juices or debris in the mouth. And I'll ensure the client is at the lowest possible position, call lighted within reach, and that would be the removal of the NG tube.